Correct statement regarding mucocutaneous bleed. Is the main presenting feature in hemophilia? No. Yep, it's a delayed and delayed bleeding. Deficiency of vitamin B is one of the causes. No, it's vitamin C, scurvy. Hemarthrosis is a deep bleeding manifestation. Henoch-Schönlein purpura, which is IgA vasculitis, is one of the causes. That's correct answer. One of the causes of vascular purpura would be chronic use of steroids. Yeah, that is one of the acquired causes. The rest are related to delayed bleeding. Myeloproliferative neoplasm causes platelet dysfunctions. Splenomegaly causes thrombocytopenia. Correct mechanism of thrombocytopenia would be use of warfarin. No, warfarin is related to coagulation, failure of platelet production. Yes, that would be the factory problem. Hypergammaglobulinemia is multiple myeloma that cause platelet dysfunction. Inhibition of glycoprotein 2B3A would be drug causes. Yeah? So that would be platelet dysfunction too. Correct statement regarding primary immune thrombocytopenia is due to alloantibody. If it's primary, then it's autoantibody. Yeah? It's not alloantibody. Alloantibody is usually related to platelet vaccine induced or platelet transfusion or drug induced. Yeah. Megakaryocyte number is reduced. No, they are usually increased or even raised, even can be normal. Antigen antibody complex is cleared by macrophages in the spleen. Yes, this is the pathogenesis for primary immune thrombocytopenia. Half-life of platelet is reduced to a few days, not few days, but it's few hours. One of the causes of platelet dysfunction would be use of aspirin. The rest, Ehlers-Danlos, vitamin C is for vascular acute leukemia is okay. Cepat siapa yang nak send, boleh send. Okay. Following are causes of inherited bleeding disorders. Okay, so Bernard Sulia, yes, it is inherited platelet dysfunction. Hemophilia A, yep, inherited coagulation. Hereditary hemorrhagic telangiectasia, the name itself is hereditary. So only the IC is the acquired causes. Okay. Correct statement for hemophilia. Yep, deletion of factor 8 gene causes low level of factor 8. Fresh frozen plasma is the treatment of choice. If this is in 1960s, maybe yes, but now recombinant and specific factor concentrate would be the treatment of choice for hemophilia. Thrombosis is not a recognized complication. Yep. In fact, transfusion transmitted infections, hematopathy. Alright, lyonizations affects the male carrier. No, it's not. Lyonizations actually affects the female. Yep. Because when there is two X chromosome, which is the female, if the normal X is inactivated, then you get the disease X to be producing. That's when the female appears to be having hemophilia. Yeah. So that's lyonization. Ada lagi tak? So I will stop accepting the responses. Correct statement for von Willebrand disease. Inheritance is autosomal recessive. No, it's autosomal dominant. If one of the partner, either father or mother have it, they can actually pass it to the children. Factor 9 is absent in type 3. So remember the relationship between factor 8 and von Willebrand factor. So it's actually factor 8, it's not factor 9. Tranexamic acid is one of the treatment option. Yes, apart from desmopressin. Type 2 von Willebrand disease is related to quantity. No, is qualitative. Yeah. So type 2 von Willebrand disease is dysfunction of the von Willebrand factor. Right. findings in type 1 Waldbrand disease, which is a quantitative disease, is raised factor VIII levels wrong. So the factor VIII level will usually be reduced, but not so reduced as in hemophilia. Increased megakaryocyte, no, it's not related to platelets. No, not related to productions, of platelets. Normal or prolonged, yes, because if factor VIII is normal, then you get a normal, but if your factor VIII is slightly low, then you get a prolonged APTC. Low platelet count, no, in fact, it can be a risk because of the iron deficiency anemia. All right. Okay, so this is the case of a lady, right, with low platelets. So it's immune thrombocytopenia. I will have to go through one by one and then give you grades. So briefly describe the pathophysiology of the disease. So there should be presence of autoantibody against platelet forming the complex, and then remove by spleen. So this will be given to you after I have marked your assignment. So the second case is hemophilia. So some of the key points in the diagnosis would be the age, the clinical presentation, the family history. All right. Next would be list further investigations to confirm the diagnosis. So after you have start with the initial lab investigation of mild anemia and isolated prolonged APTT, then you do a mixing study. Then after that, you do a factor ACEs, factor ACEs. Then you can do family screening, genetic study, DNA analysis to confirm the mutation. So for the third case would be a von Willebrand disease. Okay. Look at the age, clinical presentation, and family history. Basically quite the same with hemophilia line of investigation. But the laboratory findings, again, is quite similar to hemophilia. And you do serum iron profile if there is mild and moderate anemia in this case, because patient may suffer iron deficiency, and this iron deficiency is a treatable cause that you can actually help patient with hemophilia, Waldbrand disease. Okay, so that's it for the Google form. Thank you very much, everyone. So 72 attendees for today. All right, all the best for tomorrow, CA. Okay, so relax yourself.